There's so many people talking about longevity, anti-aging, and perimenopausal symptoms. But what does this actually mean on a practical level? I'm bringing on Dr. Desai to learn a little bit more about what you can do to improve your health, increase your health span, and your lifespan. Tell me a little bit about what type of physician you are and what brought you to do what you do. Why did you go into this space?
So I'm an emergency medicine physician. I worked at a level 1 trauma center. When I was working there, I realized that I was seeing people with strokes, heart attacks, and everyone, I shouldn't say everyone, lots of people would ask, how did this happen? How did I get a heart attack? How did my dad get the heart attack? How did my brother have colon cancer? And as much as I loved the work I was doing as an emergency medicine physician, I always asked myself, what if this person could have done something differently 15 years ago, 20 years ago? And that's where I wanted to be. I wanted to be 15 to 20 years before that person presented to the emergency room with that stroke, with that cancer, with that heart attack. And I wanted to have met them 20 years before that to have been like, if we do this, we can potentially decrease the risk of you ending up in the ER with a stroke, heart attack, cancer, the list goes on and on. So my interest in longevity medicine actually came because of my career as an emergency medicine physician working at a level 1 trauma center.
Wow, that is really cool.
Yes. So at that point, I went back. I became board certified in lifestyle medicine. I studied precision medicine. I studied genetics, including single nucleotide polymorphisms, really studied the genes like ApoE4 genes. How does your genetics affect your propensity towards certain chronic diseases? How does your lifestyle affect it? I studied hormones. I'm menopause certified. I studied GLP-1s, studied peptides. So, the list goes on and on. I spent a lot of time studying and practicing to be able to call myself a longevity medicine physician.
Okay, cool. What a really cool pivot. I don't know if I see that so often, emergency medicine.
It's actually very, very common because as an ER doctor, you see the primary care. So you can actually practice primary medicine. So you're seeing the high blood pressure, you're seeing the strokes, you're managing diabetes.
That's cool.
And you also are very multifaceted in their practice.
Yeah. I'm a family nurse practitioner. So when I started my career, I worked in an ER.
Oh my goodness.
Yeah. And I do miss the ER in many, many ways, especially doing a lot of procedures, which is, it's an interesting transition. So, okay, one of the things you focus on is menopause. And I know hormone therapy is becoming really big. Everyone's talking about it now. There was a lot of controversial topics going on with menopause where, we had a study that we're looking back and saying it was done wrong. I'm curious to know the average individual who wants to know a little bit more about perimenopause, menopause, how do they identify if this is happening to them? And then I want to break down in terms of the different type of treatments that happen and what are you putting someone on? So can you give me an example of a typical case that you see in your practice of someone who's having perimenopausal symptoms and then what their treatment will look like for a regular individual who wants to, learn a little bit more about this? I want to learn more about it. And I know there's a lot of other people who want to learn about it in a very simple form.
I'll first start out by saying that we are so much more than our hormones. So a hormone is an aspect of my care, but it's not the only aspect of our care. So a typical patient probably, let's just talk about a female. She comes in maybe in her mid-30s, late 30s, early 40s. And some common complaints I hear is going to be, I have brain fog. I can't lose the weight. I have this extra weight I didn't have before. I used to be able to eat whatever I want and lose the weight. Or I used to be able to eat a certain way, do a certain exercise, and I can lose the weight. Now I can't lose it. And the third one is usually like, I don't feel like myself. I'm a lot more anxious. I get more emotional. Things that used to make me happy don't make me happy anymore. So, my patients usually fall into these 3 symptoms. And from that point on, I do a pretty extensive assessment. We first get to know the patient. Were you on birth control when you were younger? Are you on birth control right now? What medications are you taking? What supplements are you taking? What kind of workouts are you doing? What are you eating? What is your diet? What time are you breaking your fast? So that's breakfast, right? Breaking fast. What time is your breakfast? What time are you going to bed? How much sleep are you getting? Who's waking you up at night? Are you snoring? These are some of the questions that I ask when I first meet my patient. I really want to know everything about them, because you can't just walk into a clinic, get a HRT prescription and walk out and expect to feel drastically different. You will definitely feel better, but unless we're addressing the sleep, the weight gain, the mood, it's very, very hard to walk out of a clinic with just one prescription and do a 180. So it is a comprehensive assessment. And one part of that includes hormone therapy or just even looking at your hormones.
Okay. So health is not in isolation. It's essentially like that with everything. There's multiple different things outside of just getting the prescription. So let's say a woman is having brain fog in her early 40s or mid 40s, having brain fog, gained weight, not sleeping as well, hot flashes, frozen shoulder, any of these things. What is the next step? What are you doing next?
So again, I'm going to do a very thorough history. So when was your first period? How many kids did you have? When did your mom get menopause? What are your symptoms? Are you taking any birth control right now? What is your form of birth control?
Why does that matter?
That matters because
the birth control.
It matters because there are hormones. If we want to replace your hormones, I want to know what hormones you're on. Birth control is a hormone, right? So I want to know, are you on a Mirena? Are you on an IUD? Are you taking other types of birth control? Because that could also mask some of the symptoms. Like, are you regularly getting your period? If you're not, why are you not getting it? If you haven't noticed a change in your period, it's because you're on birth control. Maybe you're not on birth control. And let's not forget, if you are treating somebody who is in perimenopause or early menopause, they could still get pregnant. So that is also a very important question, is that while we do treat your hormones, we want to make sure that we continue preventing the pregnancy if that is an option that you want to pursue, which is preventing a pregnancy. So we take a thorough history. Then we get labs. I'm a big fan of labs. I do want to see where your FSH is, ideally on day 3 of your period, which tells me where you are in the perimenopause. Is it above a certain number, which means you are in menopause? And I'd like to right here say menopause is 1 day. Most people don't know this. Menopause is 1 day, 365 days without your period. And so when people say I'm in menopause, I'm like, no, you're not in that 1 day. You may be postmenopause or you're perimenopause, right? Yeah. That's where you fall in. And we don't want to wait till that 1 day defined as menopause to start hormone replacement therapy. You can start hormone replacement therapy before it's been 365 days without your period. So a thorough history is really important to me because I want to see where they fall in. I do lab assessments. I want to know where you are right now. What is your fasting glucose, your fasting insulin? How is your health metabolically? How is your health cardiovascularly? What's happening with your hormones? What's happening with your flow? There are people who in perimenopause have heavy flow. Sometimes that can reduce their iron levels, which may lead to hair loss, which is why they came in. And so their symptom may have been hair loss, but now we've gone to hormones and we've gone to ferritin. So it's really, in my opinion, it's a thorough, comprehensive assessment to figure out that when we are giving the HRT, is it actually addressing the symptoms that they came in to me? Because a lot of times people are coming in for weight gain. And to be completely honest, walking away with an estrogen and progesterone prescription is not going to 100% address the weight gain. Yeah. So if that's their symptom, yes, they probably will get a hormone replacement therapy prescription. But I also want to make sure, are we addressing the symptoms that they came for?
Yeah, that's amazing. And what is the overall common theme that you're usually prescribing when they are going on something for hormone replacement? So let's say someone did gain weight and had the brain fog. So maybe you're going to also put them on a GLP-1 for the weight gain. But what are you going to do for correcting their hormone replacement therapy? Like, what are the things that you're usually, putting them on, and what are the different routes? So I know there's estrogen and there's different forms of estrogen or progesterone or testosterone. So I'm curious to go into those different hormone replacement therapy and understand each of them, so that people are more familiar with them. I want to be more familiar with them. I know people want to understand them more. Can you explain to me what are you usually typically prescribing? What route of administration? I know it's different per person, but is there like a usual best practice?
So there are many forms of hormone replacement therapy. There's FDA approved, there's compounded versions that are, from a compounding pharmacy and dosages that are not FDA approved. I usually opt for the FDA approved versions in my patients. And when it comes to different forms of therapy, there's different forms of estrogen, there's oral, there's patch, there's cream, and then there is progesterone therapy. Now, progesterone therapy can come as an IUD, so uterine protection. But progesterone isn't just given in perimenopause and menopause for just uterine protection. Progesterone has many other benefits, from mood to sleep. And that's when I opt in many of my patients to give an oral progesterone. But again, the dose and the route is very, very personalized to the patient that I'm seeing. There are people who may not be progesterone tolerant. There are people who need the progesterone because of sleep and mood. When it comes to estrogen, I typically love the patches. So I do love giving majority of my patients the patch. But again, that's very, very personalized. There are people who don't tolerate the patch. There are people where the cream is great. There's also something called E-string, which is so there are a lot of different options when it comes to estrogen therapy. When it comes to the average person, it really depends on the physician that you're going to. What route are they comfortable giving? Okay. What route is going to be best tolerated by you? And what's most appropriate in the stage you're in? Are you in perimenopause, menopause? Are you a few years out? So a lot of that goes into play. And let's not forget, the most important is the patient's symptoms. I recently had a patient who was like, I have no symptoms of perimenopause and menopause, but I just keep getting UTIs. And I'm like, oh, that is a symptom of perimenopause and menopause, And that patient benefited from some vaginal estrogen. I had another patient who was like, I have no symptoms, but I've started to notice some wrinkles. I've started to notice that my skin isn't as, hydrated, and it doesn't look as plump and luscious as it used to. Yeah. And I'm like, oh, you can benefit from some estrogen on your face. I also consider that a form of, hormone replacement therapy. Estrogen is not just for your uterus, right? Estrogen has receptors all over your body. So when you are talking about hormone replacement therapy, you want to make sure that you're addressing all aspects of that hormone replacement therapy. So when estrogen and progesterone decline, you can see it as a mood disturbance. You can see it as changes in your skin, vaginal dryness, changes in libido, changes in sleep. And so I want to make sure that the form and the route of delivery best is optimal for the patient's symptoms, because at the end of the day, we're treating the patient and we're treating their symptoms.
When you're talking, I was thinking that menopause is actually, treating someone for perimenopause is actually a form of longevity treatment.
Oh, 100%.
It's actually helping them live longer and live healthier, because it's helping you with your wrinkles. It's also helping you with that anti-aging process. So just part of, if a female wants to slow down her aging process and focus on longevity, then treating yourself for perimenopausal symptoms is part of that journey.
100%. Hormone replacement therapy, hormones are one aspect of your longevity, one aspect of your health. And there are many other aspects. Now, hormones play a huge role when it comes to your cardiovascular health, your metabolic health, your skin health. So they do play a role in all of them. But I think sleep also plays a huge role in your metabolic health, your cardiovascular health, your hormone health. So to me, it is one very important aspect of their longevity care.
Yeah. So progesterone we're prescribing usually when we're I noticed that you said like mood and sleep, and estrogen's more of like for dryness or hot flashes.
I mean, they go hand in hand.
They go hand in hand.
Yes. Okay. So it would be, if I'm giving somebody estrogen therapy, I'm giving them progesterone. But again, it's very, very, it's not as simple as they get one or the other. I mean, if you're putting somebody on estrogen replacement therapy and it's systemic, then you definitely need progesterone for the protection of their uterus. So I usually give people estrogen and progesterone in combination.
When are you giving someone testosterone?
It really depends. I mean, women also need testosterone. It's actually one of the, people tend to think women have more estrogen. In fact, we have more testosterone, and that also declines as we age. So testosterone replacement therapy is super important for not only a woman's hormones, but it's very important to her longevity. Without testosterone, you get a decrease in libido. It's hard to lose weight. It's hard to build muscle. And as we know, muscle is one of the most important organs of longevity. So I do think testosterone replacement therapy is important in women, and we need more research. We need the FDA to get on board with this.
Yeah.
But yeah, I truly do believe that testosterone replacement therapy is important in longevity medicine, and women, as our testosterone declines, they should also get that replaced.
Yeah, I have a question about that because it's not spoken about a lot. But what if there was a female who was a little bit more timid, wanted just more confidence, wanted to start building muscle, wasn't necessarily going through perimenopausal yet, but wanted a little bit more, should I say, like male characteristics? In terms of just her personality. Can you put her on testosterone for that?
Can I personally put her on testosterone?
I mean, do you have
point,
to be?
I would refer to her to an endocrinologist, to be completely honest. Like if there was somebody who wanted to transition, who wanted testosterone, before their perimenopausal years, and I 100%, at that time I would refer her to an endocrinologist. I think there are amazing physicians who probably would be able to better care for the patient than me.
So meaning like it could have been maybe she's like going through perimenopausal, but she's not necessarily having all the symptoms, but she just wanted to feel a little bit more. I one time heard this actually at an A4M conference where this particular physician said she gave it to some of her clients who just wanted more confidence before speaking. I don't know if you've ever heard that before, but I thought that was a little interesting.
I personally have not done that. I can see how somebody can do that, but I wouldn't necessarily start. I mean, let's not forget, testosterone is a controlled substance, right? And so I'm very cautious of who I start testosterone in, and it would be if I deem the patient to be appropriate for starting testosterone.
Okay.
So usually, we usually start testosterone in the late perimenopause, early menopause phase is where I think testosterone replacement can be beneficial.
Compound versus FDA-approved medication. When do you use, like, from a compound pharmacy or versus, a prescription that's FDA
hormone
approved?
Replacement therapy?
Mm-hmm. Yeah.
I usually opt for the FDA approved for hormone replacement therapy. Majority of my patients, most of my patients actually, have done very, very well with the FDA approved versions of hormone replacement therapy. So that being the patch and the pill. Now, there are places where many patients can benefit from compounded therapies, and I've seen lots of physicians do it. And that's where the dosing may not, the FDA approved dose is 100 milligrams, 200, maybe they need 150, maybe they need 75, So I see some physicians turn towards compounding, but
is there a downside to compound?
I mean, the upside to using an FDA-approved drug is that it's gone through rigorous testing and safety that the compounding pharmacy may not have gone through. So I think if possible, I always choose the FDA route.
Okay. And in terms of insurance pricing, it's always better through FDA because the person's getting it.
Again, it really depends, again, on the patient. If most, in my opinion, in my practice, most of my patients have gotten their hormone replacement therapy covered by their insurance. So if they're getting their hormone replacement therapy covered by their insurance and it's FDA approved, that's a win-win in my opinion. Yeah.
Okay. What are the downsides if someone is like, I don't want to go on hormone replacement therapy? A lot of people are still scared, even though they're having symptoms. Is there a downside to it?
I mean, I wouldn't look at it as a downside. My goal as a physician is to really meet the patient where they're at. So number one is education. I do my best in educating the patients. This is the evidence that we have. These are the studies that we have. And if you're comfortable, I'm going to meet you where you're at. If you don't, there are plenty of other, routes that we can take, if they're comfortable. There are plenty of people who are like, I'm comfortable with a GLP-1 agonist, but I'm not comfortable with hormone replacement therapy yet. Or I'm comfortable with hormone replacement therapy, but I'm not comfortable with GLP-1 agonist.
Yeah.
So honestly, it's meeting the patient where they're at. And a lot of that has to do with educating the patients and really understanding what their goals are and why they're scared.
What is a natural route if someone wanted to take a natural route for hormone replacement therapy? So they didn't want to go on it, but they also wanted some treatment for their whatever they're having, hot flashes.
I mean, there are
waking.
plenty of medications that are, I want to say plenty. There are medications that are approved for hot flashes. There are medications that are approved for, vaginal dryness. So again, that is a very in-depth discussion with the patient of benefits, risks. And a lot of times it turns out to be just education. Like, this is what this medication does. This is why it's good for this. And some people just, come to me and they're like, I just want to learn about nutrition. I want to see how can I eat differently at 40, at 50, at 60. And then we focus on nutrition. We focus on workouts. It really depends on the patient. But I give them my evidence-based, my evidence-based analysis, my evidence-based plan for them.
Do you think if someone wanted to take the natural route, which some people want to take like certain type of supplements to treat their perimenopausal symptoms, does it actually work? It's kind of like if someone
there
wanted
is
to lose...
no supplement that's going to replace estrogen, progesterone. That's the honest answer. There is no supplement that's going to do the job of the estrogen and progesterone that have been declining. Now, are there supplements that can be beneficial? 100%. My two favorite supplements are actually vitamin D. Most people are deficient in vitamin D, so that is one supplement that I recommend if my patients' vitamin D are not optimal. And the second is going to be omega. Actually, second I would say is B12. I actually have three. So second would be B12. If they're B12 deficient or their B12 levels are suboptimal, I do replace their B12 and they can supplement their B12. And omega-3. So depending on the patient, depending on their aging, I love giving omega-3s in the right person.
Okay, cool. So I want to talk about combo therapy with hormone replacement therapy plus GLP-1s. Full disclosure, I have a GLP-1 business. So if I had a patient who I put on trizepatide who was struggling with weight and we wanted to help them lose weight, at what point would I say, hey, I think we should call you to help with hormone replacement therapy? What are the symptoms that would that you would be experiencing aside from weight gain? And why is it, the studies are showing that if you do combo therapy, you're getting better results?
Well, the first thing is, are they in perimenopause and menopause, right? So if they're 20 years old, they definitely should not be getting hormone replacement therapy. So are they in that phase where it can potentially be perimenopause and menopause? That's number one. And then what are their symptoms? Estrogen and progesterone have tons and tons of functions in our body. So when it gradually starts to decline, there are different symptoms. Some people be like, again, weight gain, difficulty building muscle, brain fog, even things like frozen shoulder could be a result of declining estrogen and progesterone. So I usually, tell my patients that if you're in the right age, let's do a deeper dive. Let's talk about it. Let's do the blood work. Let's see, what your symptoms are. I don't see anybody in isolation. So usually when somebody comes to me, we look at the whole picture and then we say, listen, you can probably benefit from some hormone replacement therapy. You can benefit from strength training workouts. You can benefit from a sleep study. So we really just look at it holistically. So again, I'd say if they're in the right age, they have the right symptoms, that'd probably be a good time to refer them to somebody who may be doing HRT.
If I have a patient who's 50 years old, 47 years old, going through perimenopause and gained weight, we put them on trizepatide. Some of them lose weight on trizepatide better than others. But sometimes it's not just trizepatide that's going to help them. We need combo therapy. So they need to, I tell them, well, now that I know you, I'm going to refer to you. I say, okay, you need someone to go to do hormone replacement therapy. There's probably something else. It's like not my specialty. So there's probably something else going on in your health that trizepatide alone is not going to help. And unfortunately, so many people do not know, one, to do this or the right doctor to do it, because not a lot of physicians are still on board with this. And so one, I want people to be able to identify that just because you're on a GLP-1 medication that's helping you lose weight, if you're going through perimenopausal symptoms, doing it with combo therapy may actually help you even more. And why is that though? Why does it help them lose weight faster?
Well, I think the simple answer is that weight gain or weight loss is not just it's not just about GLP-1s, right? It's so multifaceted. Yeah. A lot of times the weight gain could be genetic. It can be hormonally driven. So yes, I think that putting somebody on estrogen, progesterone, even testosterone can amplify the weight loss that's already occurring on a GLP-1. And again, the answer is probably so much more complex than that because it's, again, multifactorial. I'd even put in there that if you are on a GLP-1 but not sleeping right, not addressing the hormones, not addressing the nutrition, you may not lose as much weight as you would if you were, optimizing all of it. There are people who are like, why am I not losing as much weight as so-and-so is? Yeah. And we're on the same dose and we're the same weight. Well, I think a big part is genetics. I think a big part is hormones. I think a big part is nutrition, workouts. So again, it's very multifactorial.
Yeah. Tell me a little bit about GLP-1s. Why do you love them?
I think that carrying extra weight, so obesity, is a medical condition. And now we have a medication that's not new. It's been around for over 20 years. We've known about GLP-1s for over 20 years. They have, gotten better and better. We have different versions of it with time that are improved, less side effects potentially. So I think it's a medication, and obesity is a disease. So now you have a medication for a disease. And so I think in the right person, after they've been evaluated by their physician, if it's appropriate, I think a GLP-1 could be life-changing for many people, not because the weight is coming off, but they also feel a mental load coming off. Many people who struggle with weight gain or weight loss, they're struggling losing the weight, also carry a huge mental load with that, right? They're consumed with the diet. They're consumed with the workout. They have the food noise. And now you have a medication that can come in and help. Just like we have medications that help with diabetes, high blood pressure. I mean, we have medications for other medical conditions. Now we have a medication for this medical condition.
What if someone wasn't struggling with obesity? They just wanted to lose 25 pounds to feel better about themselves, or 15 pounds?
I think a GLP-1 agonist is for somebody who is carrying that extra weight, and that doesn't have to be a number on a scale. A lot of times it goes with a body composition scan. So in our clinic, we do a body composition scan. Oh. There are people whose weight may fall in within, what the BMI considers normal, but they have extra visceral fat. In those people, yes, I 100% think that they could benefit from a GLP-1. Maybe they have visceral fat on their, extra visceral fat on their body composition scan. Maybe they have sleep apnea. Maybe they have fatty liver. And these are all indications, FDA-approved indications for a GLP-1.
Yeah. What are your thoughts, the difference between Ozempic or Mounjaro? How do you use each of the drug, or do you have a certain preference?
Yeah, again, they're two different drugs. So number one, it really depends on the patient. So is their insurance going to cover semaglutide versus tirzepatide? Because a lot of times the cost is significant for many people. Yeah. So it really depends on, for many people, what their insurance is going to cover. Now, if money was not a cost and they're going to pay out of pocket, it again goes back to the person. So it's multifactorial. Some people do very well on the lowest dose of semaglutide. Some people do very well on the tirzepatide. Tirzepatide is a newer class of medication. We do see more people losing weight a little faster with less side effects. But again, it's to the patient. I've seen patients do very well on semaglutide.
Yeah, same. I happen to love semaglutide.
Yeah.
Do you prescribe GLP-1s for outside of weight loss reasons?
I think there are many people who prescribe GLP-1s outside of weight loss benefits. That includes fatty liver. That includes sleep apnea. Obviously, there's diabetes. So GLP-1s have been approved for diabetes. So diabetes is great. And you also can take a GLP-1 if you, are overweight and you have another comorbidity like high cholesterol or a cardiac event in the past. So there are multiple indications. Let's not forget that GLP-1s decrease obesity. And with obesity comes many, many other risk factors. So just having obesity as a medical condition increases your risk of about 13 different types of cancer. Yeah. With obesity, you have inflammation, and inflammation leads to chronic diseases. So I think there is a place for GLP-1s and other benefits, but I think we need more studies. And as time goes on, I think we will find a use for them in different places.
What about addiction? What are your thoughts on it?
I definitely think there in the future is going to be a use for GLP-1 and addiction. In fact, my patients who are using GLP-1 for whether it's type 2 diabetes or for obesity have unanimously come back to me and been like, I don't drink as much. I don't smoke as much. And I think that is life-changing for them and life-changing for their longevity.
Yeah, it's pretty cool. I've actually noticed that, and this is just based off of my practice, I've noticed that GLP-1s work much better for that, like for decreasing smoking and drinking more than tirzepatide. But again, I've seen it work for both classes of drugs, but particularly a little bit more with semaglutide. And I think it's really cool. I love what you're saying. Okay, so I noticed a lot of things that you talk about in your social media where you talk about food and how you eat and how important that is and the different type of things that you put in your body and how it makes a difference. I want to just do a deep dive and talk about that a little bit. But before that, I want to say, and I want your thoughts on this, is that I think that there are a lot of people that focus on particular things about how to eat, what to eat, but they're not focusing on other things that I think are fundamentally more important. You know, and I could be wrong, like seed oil, but they're drinking alcohol and eating tons of sugar and eating processed food and not sleeping and not walking and not moving. And so obviously everything's important, but like, what is your perspective when someone comes in and you're giving someone advice, like, or either go and also putting them on different medications? Like, how do you juggle when someone's doing there's so many different ways to improve your health, but if someone's kind of like not willing to do the main things, like how much could you actually help them when they're not eating right, sleeping right? And then we talk about all the different things that they could do to optimize their health, but if they're not doing that.
I think it again comes down to education. I tell them no matter what medication they're going to be, whether they're on the GLP-1 or not, they're going to get to their goals faster when they look at their health holistically. It's not just going to be, here's one medication, now you can just eat whatever you want, you can do whatever you want. It doesn't work like that.
Yeah.
Everything needs to come into play. All the pieces of the puzzle need to come together for you to reach your goal.
Yeah.
And that could be weight loss, that could be less brain fog, that could be feeling better. You know, whatever it is, we need to focus on your health holistically.
Yeah. So, okay, I have some questions about like how you would advise someone in terms of what they should be eating or what they should avoid, because I noticed that's something that you focus on. First, tell me like the seed oil. Tell me what people have to say about seed oil. What's your take on it? People have different opinions on it. I'm just curious.
Do you mean like vegetable oil? Like, I mean, in general, you want to avoid heavily using vegetable oils, you know? So if I had to opt, I'm going to avoid fried food. I'm going to avoid, potato chips. If I have it occasionally, I don't think it's a big deal, but I think having it routinely is a big deal. So you want to make sure you're avoiding the fried foods, the unhealthy oils, and really opting for healthy oils like extra virgin olive oil. And again, in limitation, everything in limitation.
What is your biggest key takeaways if someone wanted to just improve how they're eating and what they're putting in their mouth? What are your 3 top tips for that?
Number 1 is avoid highly processed foods. So sometimes it's not about what you should be eating, but here it's about what you should not be eating. And so really try to avoid the highly processed foods. That could mean potato chips, pretzels, anything that really comes in a bag with multiple ingredients, highly processed. Avoid that as much as possible and really lean towards the whole foods. Number 2 is going to be, I don't think we're a country that's protein deficient. We are, and to some extent, but we are heavily fiber deficient. So you see everything about protein, get your protein shake. We're always talking about protein, but not enough people are talking about fiber. So I'd say my number 2 is try to get enough fiber in your diet. So you should be having fiber in the morning, fiber for a snack, fiber for lunch. I mean, there should be fiber. Every time you're eating, you should have a little bit of fiber, in my opinion. And number 3 is going to be diversifying your diet. I know plenty of people are like, no, we eat vegetables, but they're eating broccoli 4 nights a week. We now know that our gut thrives on diversifying the foods that we're eating. So really, if it's, eggplant season, pomegranate season, basil season, like have it, try to really diversify your diet by having different fruits and vegetables.
Okay, great. And what are the 3 different lifestyle tips that you would tell someone who wants to optimize their health?
Number 1 is focus on your sleep. We have an opportunity to do that every single day and it's free. So I say try to get enough sleep. I think we used to take pride in sacrificing our sleep. Oh, I can go to bed at, I pulled an all-nighter to study for my exam. And that was something we took pride in, or
True.
I wake up at 4 a.m. and I get so much done, or I went and I woke up at 3 a.m. or 4 a.m. or 5 a.m. and went for that workout. I don't think that's something that we should be proud of. I think we should get up and say, hey, I slept full 7 to 9 hours. And that is what I'm proud of today. I think we need to get to a place where we are constantly prioritizing our sleep, because even 1 or 2 days of missed sleep, so not getting your 7 to 9 hours of sleep, can have an effect on your day, can have an effect on your cognition, on your mood. So I'd say number 1 is getting enough sleep. Number 2 is sitting less. The more you sit, I think the worse your health can be. So the sitting is now the new smoking. So try to sit less. So move during your day. If you're sitting at your desk for 6 hours, maybe every 30 minutes to 45 minutes, get up and do something, whether it's jumping jacks, taking a walk, going up the stairs, but really try to sit less. And I'd say number 3 is really focus on community. I think we tell people to do all these things and they've checked off everything from that list. And at the end of the day, they haven't spoken to someone. They haven't had a meaningful conversation that has made them feel connected. As we are at the end of the day humans, and we thrive on connection. We, in fact, not only thrive on human connection, but I think that human connection is an important aspect of our longevity and health.
Yeah. Love that. And I know the world is moving towards longevity and anti-aging. Do you think it's feasible for most people to get to this place where they could start optimizing their health and not focusing so much on like fixing everything that's going on? Do you think it's feasible that the majority of the population is going to be able to do that? Or I think probably, I don't know the percentage, but it's only a small percentage of people that are working on optimizing the health. The rest of us are still kind of working on fixing the diabetic issue that we're having.
I think there will be, hopefully, I'm hopeful that there will one day be a place where we are spending more time preventing than treating.
Yeah.
And I think that will come a day. I mean, it's already starting, right? We're already focused. If you have children, you're focusing on the longevity of your children. Are we giving them healthy food? Are they getting enough sleep? I think all of that is part of longevity medicine. Longevity doesn't have to start at a certain age, like 30s, 40s, 50s. Longevity can start even before birth. How is the mom taking care of her gut microbiome? How is the pregnancy diet looking? I mean, you can start thinking about one's longevity even before birth.
Yeah. And what do you, when you envision the future of like where your clinic is going to go to, or longevity practices, what does the future look like in terms of what are most people doing and how most people are being treated, and just what is going to be the focus? Like right now, menopause is like perimenopausal hormone is the focus. Like when you think about 10 years from now, like what does that look like to you?
I think 10 years down the road, we're going to be heavily focusing on prevention. How do we prevent chronic diseases, especially things like autoimmune? And I think we need much more studies than that. Like how does our environment, how does toxins, like, we're seeing a huge focus on things like plastics, endocrine disruptors. How can we prevent exposure? And if we've been exposed, how can we, I don't want to say undo, but how can we limit and reduce the risk of those exposures?
Okay, cool. I love that. Is there anything that you wanted to focus on or talk more about?
I think sleep, movement, and food are key in really establishing those healthy habits at a young age. I think I'm biased because I'm a mom of young children. And I see that these healthy habits start at a really young age, and really having these conversations with your children, regardless of age. Even when I had a 2-year-old and she was just learning about food, it's like, oh, we eat pomegranates because these are the benefits. We eat broccoli because this is the benefit. We eat broccoli before we're going to go get ice cream because that's a little, the way I explain it to her is like, if we're going to have ice cream, then we want to have something healthy right beforehand. So it decreases the for me, I know that it decreases the sugar surge, but it makes eating that ice cream a little healthier. It's a treat, and we want to make this treat not as unhealthy. So, we have these conversations of if we're going to have ice cream. I don't think she knows the reason behind it, but she knows, okay, if we're going to have ice cream later, I'm going to try to eat healthy beforehand. And I think that's just a good habit to form, that you should eat what you want to eat, but in limitation, and then eat it in the right order, and then just be mindful of everything you're putting in your body. And I think that starts at any age. You can start that at any age.
Yeah, love that. I'm going to pivot the conversation and talk something about a little bit more on a psychological level, because I understand that you prescribe a lot of GLP-1s, and so do I, and it's a really big passion of mine. I love it, and it seems like you really love it too, and I think it's going to change healthcare as we know it and change the world. There's still a lot of shame and embarrassment to people admitting that they're on it and talking about it. I mean, I personally, even though I own a company doing it, it took me a long time to even admit and say I'm on it without feeling that I'm going to be judged. And so many people feel ashamed by it. And as much as I talk to people and say, it's not your fault, I'm just curious to know, your experience dealing with patients who are coming in for multiple issues, but one of them could be weight gain. And they're like, I'm embarrassed to go on a GLP-1, or I have a lot of shame. Like, I don't want to feel like I'm losing. It's almost as like an ego thing. Like I lost, like I couldn't do it myself. What do you tell them?
No, I tell them that obesity is not the lack of willpower. And I think there was a time where people used to think that if you carried extra weight, that it had to be because you did not have willpower. And I think that is completely false. I think obesity is very multifactorial. It's based on genetics. It's based on environment. There is so much that goes on to it. So I say, let's treat it like any other medical condition. If you have high blood pressure, you're going to get a medication. If you have diabetes, you're going to get a medication. And just like that, if you carry extra weight, if you have a medical condition, now we have a medication. And that should be, the light at the tunnel for so many people who've struggled with weight loss for so long.
Yeah, true. Love that. Thank you. My last question, and I almost have one of the answers for you because you actually answered this in the beginning, but I'm sure there's another story. My last question is there something that happened in your career that looked bad at that time, but eventually you end up looking back and you saw that it was like good for you? I think it's fascinating that you were an ER physician and you saw people essentially having a heart attack or dying, and you thought, that's what could I do to help them? And that's kind of cool. That's like a pivotal moment where, you had to go through that essentially to realize that you want to do this. It's cool. But is there anything that happened to you in your career that's like, oh, this is horrible, but that ended up being amazing?
Yes. So I grew up dancing. I actually wanted to be a professional dancer. I grew up dancing. I'd like to call myself a professional dancer. And so I was always into the physical aspect of maintaining health, right? As a dancer, as somebody who plays a sport, you're naturally more into the physical aspects of health. Like, how do I maintain my muscle mass? How do I, eat healthy? How do I create, stay up to date with my stamina as I'm dancing? So I was always really into nutrition, fitness, health. And it was almost selfish because I wanted to make sure that I continued to be able to dance and I was still good at it. And I saw the stamina as I aged. Working as an ER doctor, I was working nights, days, and my schedule was so erratic. And the more I learned about the importance of sleep, the importance of some downtime during your day, I realized that my career was taking a toll on my longevity, on my health. Not to mention the guilt of missing things like Christmas for my kids or Diwali, I'm Hindu, or, just important big events because I'm going to have to be at work that day, or not being there half the weekends during a month because I'm away. That is also part of health and longevity, that guilt that we carry of not being able to be with our family. Also, I've had an Oura ring for a long, long time. And I would notice that during my day, when Aura Ring started telling you about the stressful moments of your day or when your heart rate was increased, I thought that I was somebody who could handle the stress. I'm like, you know what? I go into the ER, I can handle the stress. But the days that I was working in the ER, my Aura Ring showed that I was much more stressed during those days compared to when I was seeing patients in my clinic. And I could see a stark difference between working as an ER doctor and the stress that it carried on me. As an ER doctor, people don't realize that it's very rare to have a train of thought that you can actually complete. And what I mean by this, if I start writing my notes, somebody's going to interrupt me to sign an EKG. Somebody's going to interrupt me and say, oh my God, there's a patient coming that needs your attention. So not only is your train of thought constantly being interrupted, there is constant noise to a point where you become almost immune to the noise. Like sirens would be going and it wouldn't affect me. It's kind of like just part of my day. Alarms would be going off and it wouldn't affect me anymore because that's just what constantly is what I was hearing. That takes a toll on your health at the end of the day. We're not meant to be in a stimulating environment for 12 hours straight with barely any breaks. So I felt like my career was taking a toll on me. And I started seeing the effects it was causing on me. And I wanted to step back and say, how can I help people who have to be in stressful environments, whose jobs put them in stressful places, or maybe, they are during a stressful place in their time. How can I help them still do the job that they're doing, but make it a little better? So as an ER doctor, a great way to say is, what is the best time to sleep if you're working all nights? What's the best time to eat if you're working all nights? How many nights should you do in a row? What should those hours look like? I mean, there's so much that goes into play there. And as somebody who practices longevity medicine, I love helping my patients who are doing night shifts now that, this is what you're doing. So how do we make you a little healthier when you're going to do the job that you're doing? And so I love working in the ER. It is a very stressful place. And I think working there really, and you realize that when we do this, we take a toll on our own health, but there are other ways that we can be a little healthier while doing it.
Yeah. Why is sleep so important?
I think sleep is one of the most is the foundation to longevity. That is when our brain is restoring itself. That's when a big chunk of our hormone work is being done. A lot of important work for our bodies and health is being done while we sleep. Yet we tend not to focus on this very important aspects. Most people don't even know that it's not only about the hours you sleep, it's also about the time you go to bed. So just sleeping 7 hours or 8 hours may not be enough. What time those 7 or 8 hours are happening is important. When you wake up, what time you're eating, what time your last meal is, a lot of that is focused around sleep. And I think we have a lot more research that needs to be done in that field. But with the data that we have, there's a lot of things we could be doing differently. And we may not even know to do it because the education doesn't exist out there prominently.
Yeah. One time I listened to a podcast by Dr. Matthew Walker.
Oh, yeah.
He's amazing.
Yes.
And I learned so much about sleep because of him. What are things that you would see in a patient that, and again, nothing's in isolation and multifactorial, but what are things that people would notice if they're not getting enough sleep? If you're not getting enough sleep, you may notice these things in you. What is that?
Weight gain. That's number one. Brain fog. Weight gain, brain fog, feeling like you can't focus, daytime sleepiness, not having enough energy when you felt like you should have the energy. There's no other reason. Mood swings, being more irritable. There's so many symptoms. You're just not getting enough sleep. And, if you have kids, you can see an exaggerated version in them. I can see when my child has not slept enough, I see it. She's crankier. Yeah. She's more irritable. And just having enough sleep kind of sometimes fixes that. And I think that's a magnified place to see that. Look at how important sleep is. You can even see it in this beautiful toddler.
Yeah. Whenever I've learned how important sleep is and whenever I'm going through a difficult time in my life, so even if I'm going through a breakup, I make sure during that time period that I sleep much more because I've learned that sleep is healing. Like when you're sleeping, you're healing. It's like plugging in the Tesla. And so when I go through difficult times in my life, I make sure I'm having extra amount of sleep because I know that my body will like heal faster and process the emotions. Right. Because it also helps with processing.
100%.
I look at it as like, plugging the car into the Tesla.
I love that.
Yeah. Thank you so much. I appreciate you.
Yes.
It was really great tips on how we could live smarter and healthier and longer. Longevity is obviously not just about living longer, but it's about living healthier longer, increasing lifespan and health span. So thanks for sharing your knowledge with me.
Thank you for having me. I love this.